Usually it's just pain behind the knee. A lot of people think it's their hamstrings because the hamstrings do attach around that area, but it's typically just the popliteus muscle that's aggravated.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast. Now, as many of you know, in my practice, I specialize in sports medicine and treating joint pain. And when I'm going and looking at joint pain, there's always a lot of things to learn. And one of the reasons that I have this podcast is so I can learn more about different types of injuries and how I can help other individuals and patients, and to also provide you for resources on how you can help yourselves. In my exploration of what I wanted to do as far as episodes and what new episodes I'm looking at, what things I'm looking at as far as treating in my practice, I came across a number of different topics to choose from. And one of the things that really fascinates me is going and learning new types of skills and going and doing and going outdoors and doing different sports outdoors. And so that led me into the world of climbing and wanting to investigate that further, and learning how I can help people with injuries that come from climbing, and climbing presents a unique set of injuries than I typically see already. And so I wanted to bring in an expert to really talk about that. And through my research and through my connections, I was able to find Dr. Michelle Snow, who is the owner of Ascend Chiropractic and a climbing and outdoor enthusiast. So Dr. Snow, welcome to the show.
Thanks for having me.
Dr. Snow is an avid climber, and she actually goes to a local bouldering gym just down the road from my office. And she absolutely loves climbing. She absolutely loves bouldering. And more importantly, she goes and works with that community and helping climbers to be able to continue doing what they love and continue climbing and helping them recover from injury. And so I wanted to learn more about her practice, what she does, and the types of injuries that climbers can experience, because I don't think there's enough resources out there for these individuals. And at the end of the day, Ethos Athletes is about being active and doing what you love. And, obviously climbers fall right into that exception. And so I wanted to bring Dr. Michelle in. And for this first episode, we're going to be talking about the common injuries that climbers experience. And so before we get into that, Dr. Snow, tell us a little bit about yourself and why do you like climbing?
I'm an Arizona native, so I grew up doing everything outdoors with my family, hiking, climbing, camping, you name it. We were out there doing it. So I just fell in love with that. I loved the Arizona weather and environment, so I wanted to surround myself with people who are like-minded in that way. So definitely became an outdoor enthusiast, as you said. And I mean, I'm relatively new into the climbing world in, technical skill-wise, but I really got into it through my brother. And it started as a way that I could kind of adventure and spend time with him and learn a skill set that he's really passionate about. But it opened this whole new world that has been really incredible, an awesome community within the climbing world. And everyone's so welcoming from my experience. But just the actual sport and activity involved in climbing, it's so challenging both mentally and physically, which is why I've really clung to it, because you not only have to have strength that you gradually build up and different types of grips that you use, but you have to push yourself mentally that you can actually attain these goals and these climbs and ascend to the top of the climb. So that's really how I got into climbing. That's why I enjoy it and plan to keep climbing for a long time and keep growing and getting better.
Yeah, no, absolutely. And obviously with your love of the sport, that's kind of what draws you to want to help individuals that or other climbers and stuff. But what is it specifically that you like about the population of individuals that climb, or what is it like working with this particular population, and what do you enjoy about working with this particular population?
Climbers as a whole, I would say, have just a tenacity to them. They always want to try to keep climbing and almost to their demise in some cases. They'll do anything they can to be out there, either outdoors or in a climbing or bouldering gym, working on their skills and growing in their climbing technique. But that's something that I am really drawn to because I like to help people get back to their activities and being out in the world, doing things that they're passionate about. So, honing in on that aspect of the climbing community, you can really use it to the advantage in my day-to-day life and my practice to lock in on what the climbers really need, and give them tools that they can use to help manage their pain and improve their movement so they can be out in the world continuing their climbing and doing what they love, spending time with the people that they love.
Yeah, no, that's awesome. One of the things that I like about Dr. Michelle is that she's a chiropractor, so a lot of people will go and think right away, okay, well, all she does is adjust your back, stuff like that. But because of her dedication to helping climbers and helping them with injuries, most of the injuries that climbers experience are in their extremities. So it's their shoulders, it's their ankles, their hands for sure, right? I mean, and that kind of makes you unique in that you're not working on backs all day. You're working on extremities for the most part, which is really cool. It's not common for chiropractors to be doing that.
Exactly, yeah. And so you hit the nail right on the head. Most people think that we are just trained in treating the spine, from the neck down into the low back. And that's what I would say in our training is our specialty, within just the whole sector of chiropractic. We're specialized spine health, but we also look at the whole well-being of each patient. So we have to look at all the joints, the whole musculoskeletal system throughout the body. And yeah, that does include all the extremities, everything from the shoulders down to the fingers, especially for climbers. But climbers, surprisingly, have a lot of issues down into the hips, knees, ankles as well.
Yeah.
Because it's very much a full body sport. So it's something that I incorporate the whole body. But yeah, I work a heck of a lot on all the extremities for sure.
Yeah, absolutely. And then with the particular climbing that you do, so you do bouldering more than anything, correct?
Yes.
So for our listeners who haven't heard of bouldering or don't know what that is, can you tell us a little bit about what that is?
Yep. So the typical type of climbing that most people think of is rope climbing or sport climbing, and that's you use a harness and ropes as you're climbing up. Bouldering is just free climbing, basically. So if you're in a bouldering gym, the walls are shorter. So because you have to be careful if you do fall off the wall, it's all padded floor underneath you, but you are climbing with no harness or ropes. So it adds another challenge to it. You really have to work on your technique as you're climbing up the wall, but also it plays more into that mental game aspect of it because nothing's going to catch you if you fall.
Yeah.
Other than the mats so you practice how to fall carefully as much as you can, but you have to push past that fear in order to push for big moves when you're trying to go on a different route up at the gym.
Yeah. And I think one of the things that a lot of people, if you haven't done it, that they probably underestimate is the amount of strength that you need in your in your hands, in your arms, everything, because in order just to do bouldering, I mean, rock climbing one for sure, but bouldering is a whole nother experience. And I've done it myself, and it is damn hard. So
Yep.
It is really hard to do, especially if you don't have that grip strength in your hands. I mean, you have to. You can speak to the different holds and stuff that you use. Sometimes you're supporting a lot of your weight on like two fingertips.
Yep, exactly. And that comes with just a lot of time and practice in those different types of holds and grips, which is something that I'm very much still doing and new to. But yeah, surprisingly, I'm very active in my, personal life and work out and keep myself healthy so that I can help other people do the same. And I am trained and work with my hands all day long treating patients. So I have very strong hands, but within the climbing world and that specific technique, it's a whole new world. It's a whole new ball game. So it's something that you have to gradually work up to and build that grip strength.
Yeah, for sure. Absolutely. Let's talk about some of the injuries that you do see when it comes to working with climbers. And obviously, yeah, you work with climbers, but some of these injuries translate into other sports as well. And so you're able to help with, I think your specialty more than anything is fixing these injuries. And so let's talk a little bit about those. And I know one of the ones that you'll probably you get a lot of questions on it, and we just talked about like grip strength is your hands, and what injuries are climbers typically experiencing when it comes to their hands?
The biggest thing and the biggest question I get most commonly from my climbers or people out in the climbing community that I talk to at different events is related to the pulley tendons. So describing a little bit of the basics of the anatomy of the hand, there's two sets of tendons that help flex your fingers. One set travels all the way and connects to the tip of your fingers. The other one connects kind of to the middle of your finger, but it's a pulley tendon that holds the longer tendon in place. And so that's why it's such a concern for climbers, because if you tear that pulley tendon, it can wreak havoc on the whole hand system and the function of it. So it's something that I get questions on a lot because, again, climbers want to do anything to be out climbing. And so if they injure those pulley tendons, especially badly, it can take months and months for them to fully recover from that and regain and rehab their strength. So it's something that they're always weary of and trying to prevent those types of injuries.
We talked about how extremities become a key role in when it comes to all this with climbing. So you have your hands, obviously very complex, hands very intricate. So injuries there can, like you said, be a little devastating for someone that relies on them so much. The next thing I would imagine, if we're looking at extremities, would be shoulders. Correct? Well, I would imagine climbers have that injured fairly frequently as well.
Yes, and I would say that's probably the primary area, the shoulder and upper back region is what I work on a lot of the time with my climber patients. And it's an area that is very intricate and complex because it's a junction point, and there's so many different types of structures and that are going through that area. So there's a lot of potential for different types of injuries. So it's an area that often needs more stability and moves too much in some ways for a lot of people. And so that's what I work on, trying to get more movement into the upper back so that the shoulder can be more stable.
Okay, so mobilizing the spine then actually helps with shoulder stability down the road.
Yes, exactly.
Okay.
So anytime, anywhere in the body, but for this region, for this example, your body will compensate in any way it can to achieve the movement that you are going for. So if you're trying to reach behind you, but your upper or mid back isn't extending well, your shoulder will compensate. And over time, you can then lead to different overuse injuries. Or if you push too hard in that one instance, you can have a pretty acute injury or a rotator cuff tear, anything like that.
Okay. When we talk about joints, I know some people will go and say, okay, this joint is a mobile joint. This one's a stabilizing joint. Well, I would imagine shoulder, primarily all mobility, right? But you still need some stability with it.
Yeah, so you need stability with it because, like, structurally, it's not the most stable joint.
Right.
Looking at the junction between the scapula, your shoulder blade, and the humerus, the scapula has a very small, like, saucer dish, I'll say, that the humerus glides on to create most of your shoulder movement. And so it's not very stable. Like the hip, for example, is a similar shaped joint, but the hip has more of a socket that the head of the femur sits in. So it's a more stable joint. The ligaments around it are stronger. So just looking at the deep down bare minimum structure of that joint, it's not very stable. So all the structures around it, the little ligaments, all the muscles, for example, the rotator cuff muscles, those are all supposed to create stability within that structure, because the actual bony structure part of it is not a super stable structure.
Okay. Now, let's jump on to the next. What would you say is the next most common injury that you usually see?
I'll say, I think the ankle is surprisingly a common one I work
Okay.
on
I wouldn't have
too.
guessed that. Yeah.
Yeah.
Okay.
Because, when you think of climbing, it's a lot of upper body strength is what you typically jump to. But again, like I said earlier, it's a full body sport, and it depends on what type of climbing you're doing too, or different types of routes that you're working on. Some use more leg power and foot positioning than others do.
Okay.
There's also a sector of climbing called speed climbing, which is a very specified route. And you're hooked into a harness and ropes, but you're trying to get from the bottom to the very top of the wall in the least amount of time as possible. And because it's a specified route, when you're training with it, you're doing the same setup, the same movements every single time. And so it can very quickly go into that overuse side of things and play into a lot of the ankle movement. So that's probably the second most common area that I work on in my climbers.
Okay. And then before the show, we talked about you were telling me some of these injuries that you see, and one of them was really interesting to me, and that because I don't think it's a very common one, and that's injuries behind the knee. So can you explain that a little bit more for me?
Yep. So there's a little muscle behind the knee. It's called the popliteus muscle. It's basically a small little strip that sits in the back of your knee, and it causes a lot more trouble than a lot of people could ever imagine, because it doesn't do a whole lot of movement, and it's a very small muscle generally. So, but what it does do is it's supposed to create stability during knee movement. So while the quads and the hamstrings are flexing and extending that knee, the popliteus holds that stability, but it also does the very small kind of unlocking and locking mechanism in the beginning of those flexion and extension movements. A lot of times in the climbing world, I see it just get tight and aggravated and causing pain for them when people are doing a lot of heel hooks.
Okay.
Do you know what heel hooks are?
I do, but for our listeners that don't, go ahead.
So basically, it's a climbing move where you hook your heel, the back of your heel, onto a hold on the wall, and you engage your hamstrings in the back of your thigh to kind of propel you up the wall for your next move. So it's not really a natural movement in a lot of ways, I'll say. So it's something that, if you're not used to training it and you don't gradually work up to using those types of moves in your climbing routes, then it can quickly aggravate that popliteus muscle.
Okay. So what would an aggravation of this muscle look like?
Usually it's just pain behind the knee.
Okay.
A lot of people think it's their hamstrings because the hamstrings do attach around that area that's by the popliteus, but it's typically just the popliteus muscle that's aggravated. So it's relatively simple fix in the office, but it can also, because it lays across and connects into the head of the fibula on the side of your lower leg, it can restrict that movement. That bone is supposed to gently glide against the tibia and the lower leg on the inside. And if it gets locked up, again, it can just cause discomfort or decrease range of motion as you're going through different sorts of activities or different climbing moves.
Okay. Could that go and affect the ankle down the road?
For sure.
Okay. I mean, popliteus, you said, pretty important muscle. Some people might have an issue with it. They don't even know it. So if they have pain behind their knee, whether they're a climber or not, that would be something to have taken a look at, essentially.
Yes, definitely.
Okay. Yeah, especially if they've done a bunch of other stuff and nothing's worked, right?
Yep.
So, all right, perfect. We're going to continue this series, and we're going to go into each of the injuries that Dr. Michelle talked about. and go through them through segments. So in episode 2, we're going to be talking about shoulder and thoracic injuries and how to go and prevent those and what you could experience if it is injured. Dr. Michelle, thank you so much for being on this show today.
Thank you. It was a pleasure.
And we're looking forward to having her on the next few episodes. So hopefully you enjoyed this podcast, and thanks for listening.